Team Dr.Reddy's and all the participants. And thank you very much, Team Reddy's, for giving me an opportunity to host this CME on redefining role of BRIVARACETAM in focal onset seizures. Well, to begin with, I should say, or rather I must admit that within a short period of time, BRIVARACETAM has played a very good role as a add-on therapy for treating patients with seizure disorder, cerebral dysrhythmia, epilepsy. My congratulations to the research team of BRIVARACETAM and my congratulations to Team Dr.Reddy's. Today's topic is a very educative topic, and I hope that this session will be an educative session for all of us. Redefining role of BRIVARACETAM in focal onset seizures. Next slide, please. International League Against Epilepsy definition of epilepsy. As we all know, disease of the brain with at least 2 unprovoked or reflex seizures occurring less than 24 hours apart, or 1 unprovoked or reflex seizure with a probability of recurrence equal to or greater than 60%. Prognosis and treatment implications. Epilepsy syndrome and the epileptic types most of us are aware: focal, generalized, combined, generalized and focal. In some cases unknown. Seizures types are focal, generalized. Focal to bilateral tonic-clonic seizures start focally, evolve with diffuse bilateral spread of seizure activities. Focal seizures can be motor or non-motor. Manifestations depend on seizure, discharge, localization at onset and after early spread. In India, prevalence of focal epilepsy is 10 to 12 million people with epilepsy reside in India. Quite interesting. What are the types? Symptomatic epilepsy. Focal seizures 56%, generalized seizures 46%. And intractable epilepsy, focal seizures 83%, generalized seizures 7%. Hospital-based studies shows higher frequency of focal epilepsy, up to 80% of seizure types. Treatment gap in epilepsy in India. Contributors to treatment gap include poor knowledge of anti-seizure medicine therapy, insufficient healthcare services, social stigma, inadequacy of HCPs trained in epilepsy treatment. The treatment of focal epilepsy, no cure exists. Symptomatic pharmacological treatment remains the primary therapy for epilepsy. Anti-seizure medicines prevent or suppress epileptic seizures generation, propagation, and severity. ASM selection depends on efficacy against focal seizures, ASM properties, patient-specific and epilepsy-specific factors. Now this is very important. Choosing an anti-seizure medication. Questions to consider when initiating an anticonvulsant in a patient include: will the common adverse effects likely to be experienced by the patient limit the drug's tolerance? How is the drug administered? Young children may face challenges swallowing tablets. It's quite natural. How often must the drug be administered? Frequent dosing schedule can lead to decreased compliance. What sort of monitoring is required? If two treatments are equally effective, opt for the one requiring less monitoring for better patient satisfaction and resource efficiency. Treatment failure and starting a new medication. This is very important. Considerable percentage of patients with epilepsy do not achieve seizure freedom with initial action. Bilateral tonic-clonic seizures are associated with higher mobility and mortality in epilepsy patients, a higher risk of physical injury, traumatic lesson, and sudden unexpected death, and poorer quality of life scores. It is of great clinical interest to control tonic-clonic seizures, both focal to bilateral and primary generalized, to reduce the associated mobility and mortality. Hence, adjunctive therapy is essential when the initial anti-seizure medications fails, optimizing seizure control by considering individual response and medication interactions. Now, BRIVARACETAM, adjunctive anti-seizure medications for focal onset seizure. BRIVARACETAM is effective and well tolerated both as first add-on and late adjunctive treatment in patients with focal epilepsy. Post-marketing and meta-analysis studies also suggest that BRIVARACETAM is a safe and effective anticonvulsant. To add on here, I would say that indeed it is also safe in pregnant patient, because we find that a female patient who was suffering from seizure disorders during their pregnancy, we advise them not to take anticonvulsant like dilvalproate, sodium valproate, etc. But nowadays even gynecologists agree that levetiracetam or BRIVARACETAM is safe for patients who are pregnant during pregnancy, and the medication can be continued. This is my experience. Behavioral adverse events are likely to be less frequent and less severe with BRIVARACETAM. BRIVARACETAM has a low potential for clinically relevant drug interaction. Well, we will not go for the graphical representation as time is very limited for my part. Adjunctive BRIVARACETAM and concomitant anti-seizure medications. To assess the efficacy and tolerability of adjunctive BRIVARACETAM in adults with focal onset seizures on specific concomitant anti-seizure medications taken as part of the treatment regime. Post-hoc analysis, pooled data from double-blind placebo-controlled trials, patient with uncontrolled focal onset seizures, randomized to BRIVARACETAM 500 to 200 mg per day or placebo. Most common concomitant anti-seizure medications at trial in 9 concomitant anti-seizure medications were analyzed. carbamazepine, lamotrigine, valproate, oxcarbamazepine, topiramate, phenytoin, lacosamide, clobazam, and phenobarbital. Adjunctive brivaracetam and concurrent anti-seizure medications. Brivaracetam consistently reduced focal onset seizure frequency more than placebo, 11.7% to 33.5%. Median reduction from baseline and responder rates were higher with brivaracetam compared to placebo. Brivaracetam demonstrates efficacy and tolerability irrespective of concomitant anti-seizure medications in patients with focal onset seizures. Brivaracetam enhances efficacy alongside a diverse range of anti-seizure medications, highlighting its broad therapeutic potential. Prospective post-marketing observation study people with focal epilepsy, effectiveness and tolerability of brivaracetam and adjunctive anti-seizure medications as a treatment for focal epilepsy in adults. Prospective study shows that 68% of participants were still taking brivaracetam, among whom 35% attained seizure freedom, 48% had reduced seizure frequency by over 50%. So brivaracetam is effective in reducing seizure frequency among adults with focal epilepsy. The study shows that real-life effectiveness and tolerability of brivaracetam in FVTCS. To determine the effectiveness and safety of brivaracetam in patients with focal and generalized seizures, FVTCS and GTCS, multi-center retrospective longitudinal study in adult epilepsy patients who experience at least one FVTCS or GTCS before starting brivaracetam baseline visit. Outcome measures, response less than 50% reduction in FVTCS, GTCS frequency, retention rates, seizure freedom, presence of adverse events at 3, 6, and 12 months. We are short of time to go for the graphical retention. Real-world evidence, the study and the results. Brivaracetam, first, adjunctive brivaracetam is focal epilepsy. Real-world evidence from the brivaracetam add-on first Italian network study, 1029, and at 12 months, 16.4% patients were seizure-free and 37.2% were seizure responders. The rate of seizure freedom was 31.2% in patients with prior brivaracetam use and discontinuation due to his anti-epileptic drug. BRIVARACETAM, a multi-center respiratory study of long-term use of brivaracetam in drug-resistant epilepsy, treated with less than 4 lifetime anti-epileptic drugs. At 12 months, mean reduction in seizure frequency was 36%, 39.7% of patients were less than 50% responders, and 17.5% were seizures free. Discontinuation due to psychiatric adverse events in 3.7%. First, older, adjunctive brivaracetam in older, less than 65 years patients with focal seizures, evidence from the brivaracetam add-on first Italian network study, 1029. At 12 months, 44.1% older and 36.4% younger patient had a less 50% reduction in seizure frequency. 18.4% patient in the older group discontinued brivaracetam. The MCAEs were somnolence, nervousness, and or agitation, vertigo, and fatigue, which is very rare with brivaracetam. And the experience study says that a pooled analysis of individual patient record studies of patients with epilepsy initially in brivaracetam in Australia, Europe, and the United States at 6 and 12 months, less than 50% seizure reduction, and achieved by 36.7% and 36.9%. Seizure freedom rates were 17.9% and 14.9%. Brivaracetam adjunctive therapy in earlier treatment lines in adults with in Canada. Interim rules of most recent 12 months with the more effective when given as first add-on. Real world evidence from 252 patient Britova 2023. Median reduction in seizures is 89.9% at 6, 9 and 12 months. Then 50% reduction in seizure, 74% at 6 months. Seizure freedom rate 51.4% those consecutive months.
शॉर्ट में जो है ना ये
See the safety data here. The overall incidence of T is diminished over time. Now, safety and efficacy of brivaracetam in children epilepsy. Our systematic review and meta-analysis 2023 methods. We performed a systematic review and meta-analysis following the Cochrane Handbook and preferred reporting items for systematic reviews and meta-analysis, PRISMA guidelines, 4 databases including PubMed, Embase, Web of Science and Cochrane Library were research studies reporting the use of brivaracetam monotherapy or adjuvant therapy in children aged below 18 years were eligible for inclusion. Each stage of the review was conducted by 2 authors independently. Random effects models were used to combine effect sizes for the estimation of efficacy and safety. And the results, a total of 1884 articles were retrieved and finally 9 articles were included, enrolling 503 children with epilepsy. The retention rate of brivaracetam treated was 78%, 95% with the responder rate reduction of seizure frequency, 50% was 35%. The freedom seizure rate, no seizure, was 18% and 95%, and the incidence rate of any treatment emergent adverse event, the most common TEA was somnolence, which had an incidence rate of 9% and the incidence rate of mental or behavioral disorder was 12%. To conclude with, our systematic review and meta-analysis showed that brivaracetam seemed to be safe and effective in the treatment of childhood epilepsy. Thank you so much for your patience and listening to me, and I hope that in future brivaracetam will play a more important role in treating patients with epilepsy, seizure disorder, cerebral dysrhythmia. Thank you once again. Thank you, team Dr.Reddy, for giving me an opportunity to speak on this subject. And I hope this session is educative for all of us. Thank you so much.